may have some bad cough, you may have some vomiting, diarrhea, stomach problems. Some people, they can get strokes or blood clots and things like that. But the most dangerous one I'm seeing now is like they get lung infection and pneumonia. They get suffocated from inside. And some people, they get mild, like flu. We are in the flu season now. We are going to get some flu. Some people, they get flu shots every year, and they get mild symptoms. But this is dangerous, more dangerous, because we have no immunity. And they infect people and kill people, though, especially those with diseases from before, like diabetes, high blood pressure, heart problems, cancer, etc., elderly people, low immunity. And we see that in the nursing homes and elderly people, how they are dying right and left from disease. The younger people, they have more immunity, but still, in the second week, I'm seeing more younger people now. Thank God, children are not getting more infected, but still, some of them are starting with that new variant of viruses. Viruses, by the way, they change. They make some mutation like the flu virus. You remember you got the flu shot last year? It may not work this year because there is a new flu virus. Same thing. But thank God that the vaccines that developed recently, this is the light at the end of the tunnel. The dark tunnel will be going through almost a year now, from March until now, that the vaccinations start coming up. I'll tell you about that in a minute. So this is give you an idea of the disease of corona. That's how this gets infected, how to protect yourself by staying away from big gatherings, especially the holidays are here. Staying away from like big weddings, engagements, big gathering from people you are not familiar with. Gather with the people in your household, the very close friends, very few, less than 10. And not stay away from big gathering. If you go out, always wear your mask and sanitize your hand. If you touch anything, you bump gas, you buy food from the supermarket, you have the hand sanitizer, always use it. Because if you are infected, you may touch your nose and this and go inside. And try to limit your activities and travel to the minimum unless it's really essential. These are some of the parts that's important, how to prevent yourself. And inshallah, if you get mild symptoms, stay at home and take some Tylenol if you get fever, some cough medicine over the counter, and bed rest. Isolate yourself if you felt infection, you went and you got a test, you got tested positive. Isolate yourself in a room, stay away from their family. Keep their family away, you can send them to another place and to a hotel, or yourself, isolate yourself in a separate area for at least 10 days. It used to be 2 weeks, now they downgrade it to 10 days. If after 10 days, or after a week, you feel fine, and so there's no more symptoms, 3 more days, you are okay to go back. But still use your precautions. And if you are sick and isolate yourself and you got sick badly, with a bad fever, vomiting, stay for at least about 10 more days. We say 20 days to be non-infectious. But if you got it mild, 10 days is very good. If you got very sickness, 20 days, and then you can, because if you got very sick, you have to go to the hospital, you go to the hospital. Call your doctor. He may prescribe you some telemedicine from the computer, he may prescribe you some medications. If you are ready to say, call 911 or go to the hospital, especially if you get trouble breathing, if the condition can very weak and things like that, you know when you get very sick. But if you are mild sickness, please stay at home. And and we know that the vaccines has been with us for a long time. It used to take many years to develop a vaccine. But with the new technology, thank God that some companies like Pfizer, BioNTech, and they've been working actually for 20 years to develop a new way to develop a vaccine. A vaccine, we know that, for example, the Sinopharm in China, they are using the same virus attenuated or weakened. They multiply it in the lab, and that's how they're using it. It's expensive, and it's being studied partially in China, but they are sending to other countries to study it. The recent country that studied that Chinese one was in Turkey, and they said still it's good, but has side effects. Has not been completed the certification by the World Health Organization or China itself. And there is the AstraZeneca that's in England. They use part of the protein of the virus to make the body stimulated to make antibodies against the virus. It's in England with Oxford University. And the third one, like the Sputnik vaccine, that's in Russia. They use part of the DNA from the virus to develop a vaccine also. They use that in Russia, the Sputnik vaccine. And the recent one, alhamdulillah, that the US governments, which Food and Drug Administration, which they control your medications safety and your food safety, Food I proved that. They give us authorization like temporary authorization use or emergency authorization use. Emergency use authorization, that means the benefits of this vaccine outweigh the risks. The benefits are more than the risk. That's why they give it emergency approval, because the company, they used it, Pfizer and Moderna, they tested on thousands of people, and alhamdulillah, very, very minimal side effects, and they found the people who took this virus who took the vaccine resisted the virus infection, which is great. Some people, they said, how come they made this virus quickly, the vaccine quickly? With the new technology, and we know that the virus has what we call DNA. This is like the fingerprint of the virus. It's the core of the nucleus of the virus. They took a strand called RNA, which is ribonucleic acid. This is like the name of the protein. You don't have to know about that. And they make it like messenger, MRSA. M stands for messenger. And they developed that amazingly in the lab. They were able to see the sequence of the protein of that RNA in the lab. They saw it was very strong electron microscopes. Like the new technology, were able to sequence the protein and synthesize it from protein DNA in the lab. And that's how they were able to replicate that millions of vials like you see nowadays. It's something new. And when they injected that to the person, they found that the mRNA goes on the cell and it goes in the cytoplasm, not in the nucleus of your body. They go to the cytoplasm and they instruct the cell. You remember the virus, when it enters, what it does? It tells the cell, make me millions of viruses. But this vaccine, it tells the cell, make me only the spikes. You remember the spikes? You know the spikes is like the one that's the clips, like remember, or that it holds on that. When you see that virus in the microscope, you see the things like the sticking thorns. And the cells start making that spikes. And once they make the spikes, the cell realizes this is a new invader or a new foreign body here, and they start making antibodies against that spike. And when the actual virus comes and get infected, the antibodies are there ready to stop and attack the virus itself. And that's how the Pfizer and Moderna virus is working. It's a new technology, it's safe. I took it myself more than a week ago. Alhamdulillah, I'm sitting here fine for it. I did not turn to an alligator. They are not robots following me up. I'm not increase your rank. It's all honest. Please listen to the scientists and listen to the professionals. There is many rumors on the internet and on Facebook and on YouTube. And listen to the professionals. Don't listen to only those who are spreading rumors. And some countries, they get calls from overseas, shall we take this vaccine or this? Said if it's approved by the WHO or approved by respected organizations like the FDA here, and we have recently the CDC with this Center for Disease Control, which made a panel to be fair and just to distribute the vaccine all over the United States. And the first, there's 3 stages. The first stage, of course, the health professionals like us, nurses, healthcare workers. The second stage will be people who are in direct contact with the people like teachers, police officers, firefighters, etc. And this will be starting, inshallah, next year, hopefully by March. And then after that, there will be the general public, maybe by April, May, until inshallah July. The United States have enough vaccines to vaccinate at least 70% of the people. And Dr. Fauci yesterday, he said, to reach a healthy community, like to have this disease like any other disease, we have to vaccinate at least 70 to 80%. He increased it by 10%, 70 to 80% of the population. Hopefully, inshallah, by the summer, all this calamity will be over. This calamity happened to everybody. Happened, you get disease, you get sickness. Allah subhanahu wa ta'ala, Allah got sick from eating the lamb. You remember the Jewish lady who fed him the lamb, and the lamb talked and said, "Oh prophet, spit me out, I'm poisonous." And some of the stories, they said the Rasul was aching from that in his stomach. Sayyidina Umar, when the plague hit Sham, and he took precautions. If you are healthy, don't go inside that epidemic. If you are in the epidemic, don't go outside. So we have examples of this, how to deal with it. Allah subhanahu wa ta'ala, Sayyidina Ibrahim said, وَإِذَا مَرِضْ فَهُوَ يَشْفِينِ. If I get sick, Allah will give me help. So the health is not coming from vaccines or we get this. ask Allah subhanahu wa ta'ala,
Right.
and use the means that Allah subhanahu wa ta'ala gave. Your Rasul said, Tadawu ibad Allah. Oh, worshippers of Allah, use healing, use cure.
Yeah.
Allah, ما جعل الله من داء إلا وجعل له دواء.
الدواء.
Allah did not create a sickness or a disease unless He created with it also a cure. So everybody should seek the cure. If you offer the vaccine, take it. If you are sick, and stay away, especially with all those who go to the mosque. Please don't go into the mosque if you are sick or around anybody sick with the corona. Notify anybody or friends or family members or the community that you're around that you are being sick. And what happens if you get the vaccine? Some people that ask me, are they going to get sick? You may get a little fever, aching, muscle pain,
Do you have any questions?
tenderness, nausea.
Any
Some
questions?
people, they get nothing. I have some colleagues, they got only a little fever.
Do you have any questions?
And some headache, but all mild. It's better than getting the whole disease. And who should be getting, everybody should be getting the vaccine, except for those who have severe allergy problems. If you have allergy problems, severe to medication food, don't take it for now, unless your doctor will tell you to give you medication to prevent the allergy. If you are breastfeeding or you are pregnant, communicate with your doctor. Because this company, they didn't have enough people who was infected by breastfeeding and bring women to have tried the vaccine on them. Although it is still safe, but they recommend communicate with your doctor to see what is the recommendation. And are there any other choice available to prevent the COVID disease? Currently, there is no any approved alternative vaccine except what I have mentioned. These vaccines, which alhamdulillah we are currently have right now. And can I receive the vaccine with other vaccines? Yes, if there is no, if you take the vaccines, it's okay also to take this one. Will these Pfizer, BioNTech, or Moderna give me a COVID-19? No. All the thousands of people who received the vaccine did not catch the virus. And even if they tested them, they were negative for the virus. So that's how this vaccine was effective. So there are many other questions about the virus itself. When is the best time to get the vaccine? The vaccine, how to get it when you are time off or you're about to be off. But if you
Doctor.
get it, you get it in time.
Dr. Nouh, salam alaikum. Doctor, we have some brothers here. They have some questions for you. Live, inshallah. Brother Mahmoud.
5-10 minutes, I'm open for questions. I know you have a lot of questions, and please go ahead. Start.
Sure, Brother Mahmoud, go ahead, Sheikh.
Assalamu alaikum, Sheikh.
Salaam wa rahmatullahi wa barakatuh.
Jazakallah for your time. My quick question, since you mentioned the immune system, as far as someone that's elderly age, what do you recommend naturally for them to take to increase their immune system in a sense rapidly?
Like to take the vaccine itself? Or
No, not vaccine. I'm talking about the immune system. To improve their immune system, something natural, whether if it's some type of vegetable, what would you recommend?
The recommendation now is really good diet, stay in good health. If you're smoking, don't smoke. If you're sedentary, go and make exercise. Expose yourself to fresh air and sun, and eat good diet. Supplement vitamins will help your body in shape. Yes, you can take, but they are not really a cure. They are not preventing you from getting the virus. They are keeping your body in a good shape. You take multivitamins, vitamin D, vitamin C, zinc, and they think that will help you out to be in stay in shape. But it is not a cure.
Okay.
Those whose immune compromised disease, getting cancer treatment, getting radiation therapy, they are to avoid getting the vaccine until the doctor tells them it takes at least 6 months because the immune system is too weak to make the antibody for the virus. I hope I answered the questions.
Jazakallah khair. I have two questions, doctor. just two questions, just not more. Now, Jazakallah khair. Now, somebody, he already get the coronavirus. And the doctor tell him, just go home, stay in quarantine for 14 days or whatever. What should he take during the medicine or something like to increase the immune system or to, is there any cure plus the vaccine? Forget about vaccine now. The vaccine now, this is second question, doctor. What you have to tell us about to advise us about the vaccine, because too many people in the internet, social media, they said there are too many things in the vaccine. Is that real? Or you are a medical doctor and you take it, I know that you take it yourself. What's your advice to us?
The first thing, there is no home cure for coronavirus. Coronavirus still is a virus. The only thing, when the patient comes to the hospital very sick, we give them some remdesivir, which is antiviral, and still like questionable about efficiency, and we give them something called new monoclonal antibodies. Monoclonal antibodies, like similar to the antibody your body make against this, is in the hospital, in the test period, you are really safe. At home, only take remedies that to help relieve the symptoms. There is no cure. And vitamins, like I said, good health is very important. And weight loss, you do your weight. If you are smoking, you're doing other consultation habits to your body, stop that. And good family support is excellent. We get, many people now, not only they get really bodily, they get emotionally also.
Right.
The quarantine and the people emotional, we see a lot of abuses, domestic violence, children, etc.
Yeah.
It's getting, so this mental health also is very important. So good health, good food, and good environment, and healthy environment around you, and good habits, that will protect you. If you take extra, here's the vitamin. If you get a cough, take over-the-counter cough medicine.
I see.
If you get
Okay.
fever, body ache, take Tylenol or Advil.
I see. Okay.
And so on. There is no cure unless your doctor. You communicate with doctor, your doctor will prescribe you some medication. You get like bronchitis or you have a cold, you get some vomiting, diarrhea, etc. Your doctor will prescribe you medication to help alleviate these symptoms, short of admitting you to the hospital, which I don't advise you unless you're really sick.
Beautiful
And
advice.
the second one, the vaccine.
Yeah.
I get a lot of the vaccines. If I already had the COVID-19, do I still need to get vaccinated? Yes. Like Brother Tarek, for example, he got the coronavirus, and it's good for him to get the vaccine also. What happens with this new virus, it gives you the infection, and the countdown, the antibodies, lasts for maybe like up to 90 days. And some of the people who got infected once, they get infected again. So that's why you advise those really who got the corona infection, take the vaccine. It will be protected them over the long range of time. For how long? It's still in the studies, but it gives until now many weeks and months of protection. It's still in the studies. And these are some of the questions. Some of them said, should I get natural immunity for COVID-19 rather than taking the vaccine? No. We saw the people who got the infection, they get infected, they can get severe. You may get it mild, but can you guarantee you get it mild? No, take the virus.
Doctor,
And go ahead.
excuse me. I need to know how to answer those who are saying they putting something, the vaccine, people can track you, like chip, whatever. I need to cure their mind from these ideas, because it's negative ideas, and they give us videos, somebody's cheating, and they claiming they are taking the vaccine. And they have pork also. They said pork. They have pork. And zabiha, not halal. Okay, doctor.
The mRNA, which is a strand of the, like a fingerprint of that virus, it's very vulnerable to be destroyed in the body. And that's why they developed some stabilizers, some chemical stabilizers. It has no code, it has no tracking. They are not going to change your body, they are not going to make you an alligator or crazy. I took more than almost like more than a week now, and I'm still sitting here, the same person from 40 years over here.
Yeah, doctor, I saw I'm sorry, I saw something in the internet. They said the DNA, when you take the vaccine, they get it from the rat, and they get the DNA of the rat gonna be in your body, the DNA. I was laughing. But I said you have to ask a doctor, sir. It's not my field to answer. But
there is a lot of fallacies and rumors,
yeah.
And don't believe this, believe it from the real scientists.
Yeah.
And we have the respected organization, the Food and Drug Administration, the CDC, and call your doctor, get the information from your doctor. Don't listen to the internet and social media opened a lot of gates of information. Some of them are true, some of them are false and rumors.
Sheikh Google, yeah.
Look up the correct ones, and the virus that the vaccine we're getting, at least in the United States, has nothing to do with animals, nothing to do with pork, and only stabilizers to stabilize it once they enter your body. And the RNA, that one does its job, it gets dissolved in the body, and all these stabilizers get dissolved harmless particles.
Alhamdulillah.
No, it does not change your DNA. It's not going to change you. Nobody is going to track you. It's not going to drive you crazy. And I'm a live person here who took the vaccine. Dr. Fauci, which is the real expert that I feel well respected. He took it in front of all of us. Dignitaries, presidents, ministers, and VIP people, they took it. And if they really have any doubt, or the doctor have any doubt, you wouldn't have advised them to take a vaccine. Good question.
جزاك الله خير دكتور. يعني if I take it, my name will never change from Mr. Friday to Mr. Thursday. سيد جمعة تبقى يا شيخ. أبو الشيخ محمد. Go ahead, Sheikh Muhammad. We have brother Abrar first, Maulana.
No, that's fine.
But okay, go ahead, Sheikh. Go ahead, inshallah.
Oh, no, we're talking about the virus. If somebody got infected with the virus, positive, there is no cure. But isn't this the virus already in the body and could expand or multiply? So what was, because and also we need to know what's the difference between virus and bacteria, and there is no cure for any virus at all? That's the question.
When the virus enters your body, and some of the viruses your body has immunity from it from before, you are going to get common cold virus, you get like dry nose, sneezing, some people get headache, body ache, etc. Your body is really fighting that virus. If the body does not have the immune system like this new coronavirus, then it's something new. The body is not going to recognize immediately. It invents late when it's already exploded in the millions inside your body. And some people, they have better immunity than others. Some people are in better health, and some people they get it very mild, like flu. Some people they get it very sick, immunocompromised, elderly, etc. And some people they got sick even 2 days after they exposed. Some people they exposed after they get the symptoms 5-7 days. And many of the experts said after 10 days the virus levels start going down. And in 2 weeks it is you may get like a positive test, that means it's still there, but it's not infectious like it used to be, like within 1 week to 10 days. That's why we tell people who got infected, like Brother Tal, for example, and after 1 week, 10 days, you don't have any signs of fever or headache, etc., you feel fine. It's okay to mingle again with the people with precautions. And because the infectious rate was very minimal, like different from the beginning of the first, from 2 to 10 days, like mentioned. So the virus may be still there, but it's not detectable. You don't get infections easily from the virus. Your blood test may be still positive, but you're living normal, and the virus does not cause infection like it used to be in the first 10 days, like you mentioned.
Jazakallah khair. Jazakallah khair. We have Brother Abrar. He has a question for you, Doctor. Go ahead, Sheikh.
Jazakallah khair, doctor. My question is related to the people, old people actually. I have some old people in my family. So, like people, those who are in age of like 75 or somebody are in 80s or 90s, how safe is this virus for them? Do you recommend them? Because we don't know the side effects.
Is there the virus or the vaccine?
With the vaccine, I mean, we don't know the side effects of the vaccine as it is in initial stages. How safe it is for senior people like 70s and 80s, and is it safe to give it to newly born babies? So
the virus, as I said, recommended for everybody, especially for the elderly. They are actually in the second tier after doctors and nurses, etc. They're supposed to get it if they have their own doctors. And they are going to recommend them because they are the second priority, hopefully inshallah by next year, the beginning of next year. And it is very recommended for those who have sicknesses, yes, elderly, yes. I see a lot of which unfortunately they come to us from nursing home in their 80s and 90s. They are very sick. And that's even some states, they start giving it before the doctors to the nursing home patients because they are the most vulnerable and the most people die from. So if they are elderly and they have sickness, yes, they must get the vaccine. Unless I mentioned that there are very few cases. For infants or kids, they don't know yet because they didn't have enough patient data to try the vaccine on them. But they can talk to the doctor if everything will be individualized case. A pregnant woman or a breastfeeding woman, she has around many people, or her job exposes her, the doctor may recommend. Same like children. It's been a safe vaccine and has very little side effects, and alhamdulillah it was effective. And this is a new technology, this is a blessing from God, because this is really something new. And you remember the Spanish flu, the 1800s, last century, millions of people died from that. You remember that smallpox when they introduced it to South America, millions of Indians died from that. So, alhamdulillah, with the vaccination that currently me and you are taking, preventing us from many diseases, diphtheria, mumps, measles, polio, and all this TB, etc. So, yes, elderly people must take it unless what the people that I mentioned before. Very good question.
جزاكم الله خير يا دكتور.
I got a question.
يا شيخ. Muted. Yeah, I have another question here, Dr. Nouh. Brother Sayyid Rahil, inshallah, I can have a question for you.
Go ahead, brother.
Dr. Nouh, Assalamu alaikum.
Walaikum assalam.
Yeah, my question is, what are the pros and cons for a young female who's newlywed? If she does get pregnant, what are the pros and cons with this vaccine, if she takes it?
And if we said also, besides recently, if she is pregnant, they have to talk to their OBGYN doctor. The doctor who's following up for pregnancy, he's the one that will recommend to take it or not to take it. The company developed the vaccines, Moderna and Pfizer. They said they did not have enough people who were pregnant to test the vaccine on them. But they tested on many people with very little side effects. Her doctor may or may not recommend the vaccine. And we have people who got pregnant and they got the corona. Their infant born one actually has the antibodies. This is a blessing of Allah. Children, alhamdulillah, they are blessed to get it, but still, some of them they get sick with the disease. Like we found out the inflammation disease, especially in Europe. And she has to communicate that really with her OBGYN doctor. He's recommending. If he recommended to take it, yes. If he could not to take it yet, do it. That's also yes.
What about?
That's what even the FDA and the CDC and the companies themselves.
Yeah, what about the female that, if, say for example, she takes the vaccination now, maybe she's 15, 17, 20, whatever it is, and then she tries to have children, say 3 years, 5 years down the road, would that be some effect because of the vaccine that she may not be able to get pregnant?
Yeah, they found out it has no genetic mutation or any genetic or does not cross the placenta barrier we mentioned. The baby in the womb is very well protected from many viruses and the bacteria. The whole of God, the placenta prevent that. The antibodies, when the vaccine enters the cell, it can instruct the body to make the antibodies. So if the antibodies are there protecting the mother, protecting the mom, also protect the infant. Did the infants going to develop antibodies? They found people who, pregnant women who contract the coronavirus, the baby was born with antibodies. That's the blessing of Allah. But if she takes the vaccine and she gets pregnant, no, there has not been any studies to say the infant will suffer from any genetic disease.
No, I think my question is, will she be able to get pregnant? If she does take the vaccine, would she be prevented from getting pregnant?
No, it has no effect on the reproductive system of the woman or the reproductive system of the man. Does not affect the ovary or the ovulation.
I see.
Does not affect the sperms of the man. Does not prevent the pregnancy procedures or the pregnancy protocol. It only affects the cell to make antibodies. It does not affect the reproductive system of the men or the women. Yes, it does not.
Jazakallah khairan. Jazakallah khairan. For the audience, those who are listening to us via Zoom, do you have any questions, brothers or sisters, to Dr. Mahmoud? If anybody has any question before we end our program, inshallah. Any question, Jama'ah? Jazakumullah khair, inshallah. Inshallah, man.
Thank you very much for this. People, thank you very much, everybody who's listening. And Sheikh, on this beautiful Saturday, Sheikh Said is going to make a beautiful dua.
Jazakumullah khair. تعال Sheikh Ali. Sheikh Ali Shamsuddin is here. Dr. Nouh, I want to see your face.
We enjoy listening to his beautiful voice.
تعال تعال. دكتور خلاص يلا اقعد يلا عشان ايوه شايف اعمل لنا دعاء.
منور.
نعم.
منور يا دكتور نوح والله. منور.
ها؟ ايش اقرا لم نشرح يلا. واعمل لنا دعاء. لم نشرح والدعاء يلا.
لم نشرح بس ولا؟
يا لم نشرح كفايه الناس عايزه تروح. يلا.
أعوذ بالله من الشيطان الرجيم. بسم الله الرحمن الرحيم. ألم نشرح لك صدرك ووضعنا عنك وزرك الذي أنقض ظهرك ورفعنا لك ذكرك فإن مع العسر يسرا إن مع العسر يسرا فإذا فرغت فانصب وإلى ربك فارغب. بسم الله الرحمن الرحيم. إنا أعطيناك الكوثر
صلى الله عليه وسلم.
فصل لربك وانحر إن شانئك هو الأبتر. صدق الله العظيم. اللهم يا رب العالمين ورشد القرآن العظيم وبحرمة من أرسلته رحمة للعالمين ترفع عنا البلاء. اللهم ارفع عنا وعن الأمة الإسلامية البلاء. اللهم ارفع عن المسلمين البلاء. اللهم ارفع عن العالم كله البلاء يا رب العالمين. اللهم ارفع مقتك وغضبك عنا. اللهم ارفع مقتك وغضبك عنا. اللهم إنك عفو كريم تحب العفو فاعف عنا.
آمين يا رب.
اللهم إنك عفو كريم تحب العفو فاعف عنا. اللهم تقبل دعاءنا واشفنا واشف مرضانا وارحمنا وارحم موتانا واهلك اعداءنا ولا تخيب فيك رجاءنا وانت على كل من اذانا. اللهم كن لنا ولا تكن علينا. اللهم احشرنا في زمرة نبينا وتحت لواء حبيبنا واسقنا بيد النبي صلى الله عليه وسلم شربة هنيئة مريئة لا نظمأ بعدها ابدا. وصلى الله على سيدنا محمد وعلى اله وصحبه وسلم.
جزاكم الله خير. السلام عليكم ورحمة الله وبركاته. السلام عليكم brother Arif Jan. Assalamu alaikum, jazakumullah khair. In the end of this program, I would love to thank all of you, dear brothers, those who are attending. And I would love to thank Sheikh Muhammad Atiyah, Sheikh Tariq Abdul Rahman. I would love to thank Dr. Mahmoud Nouh, jazallah khairan. Also, brother Arif Abidi, jazallah khair, brother Qasim, to all of you. And I would love to thank brother Sayyid Rahim, jazallah khair, he's behind the computer there, right there, he's managing everything. Brother Chance also for all of this beautiful activities in the Islamic Center of Reseda, and this is because of all of you. Jazakumullah khair. And I would love to thank our Qamar, Sheikh Ali Shamsuddin. Jazakallah khair for all of this, mashallah. He came driving from all the way San Diego just to enjoy his recitation tonight. Jazakallah khair. Thank you very much. Inshallah, we'll see you in different programs, inshallah. And may Allah subhanahu wa ta'ala bless you this year and the next year and give you the barakah and the rahmah and the mercy and tranquility. Ameen ya Rabbil Alamin, and save you and your family and all of our Muslim and non-Muslim community here in the United States of America, beautiful country. Ameen ya Arhamar Rahimin. Subhan rabbika rabbil izzati amma yasifun wa salamun ala al-mursalin walhamdulillahi rabbil alamin. Wassalamu alaikum wa rahmatullahi wa barakatuh.